Hey, welcome to the Memorizing Pharmacology podcast. I'm Tony Guerra, your host, pharmacist, and pharmacology professor. Again, we're going through nursing pharmacology, and we're still in Chapter 1, Kinetics and Dynamics, and we're going to go through some other activities that were, these critical thinking type activities. When I refer to memorizing pharmacology, I'm actually referring to a book. I did this originally because a nursing student came up to me and was like, I just can't catch up. And I said, okay, well, here's some other things. He's like, I don't have time to go read all those things. And so I took a deep dive and said, all right, well, what can we do to kind of solve that? And the person was a runner. And I said, well, do you listen to stuff when you run? She's like, yeah. And it's like, okay, well, let's see if we can, make some recordings that really kind of compartmentalize things. And when I talk about ordering things, which is really what the Memorizing Pharmacology book did, was it took the top 200 drugs, and then the update has, the second edition has 350 drugs. But it put them in an order, put them in pairs, made it a lot easier to follow along and remember things. And so I'm going to give some recommendations on how to pair things up as we talk about this second critical thinking section. But I took a deep dive and I hired a wonderful British narrator, James Gillies, for this one, and then a British narrator for the other one. Because some people say, well, pharmacology is kind of like reading the phone book. I said, all right, well, what would make the phone book exciting? Well, the British accent always makes it a little more exciting. But when I talk about some of the things and pairings and things that I'm doing, I'm doing that and talking about memorizing pharmacology. So let's look at these learning activities. There's an interactive activity where we have these drug cards. And what I wanted to do was talk about using drug cards, or really any kind of cards like this, and maybe a better way to do it, because what you're going to have is a lot of words. And what I'm going to do is try to give you maybe a mnemonic sometimes, or maybe a little bit of a clue on how to remember what's going on or what to pair it with. It's so much easier when you compare and contrast than when you try to learn something in isolation. So let's start with card 1, the movement of drugs within the body. And I don't I don't need to flip it to see what it is, but that would be pharmacogenetics. And immediately I would think, well, the other one that I would want to know is pharmacodynamics, because pharmacogenetics is the movement of drug within the body, and then that's going to be the absorption, distribution, metabolism, excretion. Absorption usually through GI, small intestine, distribution usually the blood, then metabolism generally the liver, and excretion generally the kidney. But we can turn the card and say, okay, it's pharmacokinetics. But I would have paired that with pharmacodynamics. And that isn't a card, though I think the pharmacology one should have been pharmacodynamics, which we'll get to in a minute. Okay. All right, next one. Refers to the dose required to produce a specific intensity of effect. And when we're talking about intensity and dosage, we're really talking about potency. And so what sometimes we want to do with something like this is say, all right, well, let's give an example. When you have ibuprofen 200 milligrams and Aleve, which is like naproxen 220 milligrams, can one of those do it at a lower dose, right? And when we're talking about that, we mean like milligram strength. So if you're talking about something like, acetaminophen, which is generally, 325 milligrams, or maybe it's 650 milligrams, does it take about an extra strength Tylenol to do what ibuprofen could do in 400 milligrams? That's potency, where ibuprofen's 400 milligrams is more potent, takes less milligrams, to do what acetaminophen or Tylenol does with 650. One's not stronger than the other, it's just more potent. Next one is the sine qua non of drug effect. Simply put, as the dose of drug increases, the response should increase. So I never like seeing Latin in here. Sine qua non, I do speak some Latin, actually. My grade school schooling had it there. Sine qua non means without which not, which sounds like that doesn't really help at all. But what it's basically saying is if you don't have the drug dose increase, you shouldn't have the response increase. But the sine qua non of drug effect is dose response. And so you see the word dose here, you see the word response. We just take the most important two words from those two sentences and again, turn it to show you its dose response. Next one, the maximum effect of which the drug is capable. And when we see effect, we see the EFF when we might think, okay, well that and efficacy, EFF, both have EFFs in them. Maybe that's an easy way to remember that efficacy is the maximum effect. Separation between desired and undesired effects of a drug. A desired effect, and this is where we might want to pair side effect with adverse effect because they're similar but not the same. Okay, so a separation between desired and undesired effects of a drug, this is actually going to be the selectivity. Okay, the selectivity. And the classic take home for this one is going to be beta blockers and beta agonists. So a beta blocker like metoprolol is quite a bit more specific for the heart than a non-selective beta blocker. And the reason we're concerned about that is because a beta blocker may affect the lungs, and we really never want to suppress beta 1 because that would contract to some extent the lungs. And there's that mnemonic one heart, so beta 1 is with the heart, and beta 2 is with the lungs. So when we suppress beta 1 and we lower the heart rate, that's good for hypertension. But when we're suppressing beta 2, the lungs, that's not the best thing. So selectivity is that separation between desired and undesired effects of the drug. The breakdown of orally administered drugs in the liver and the intestines. Well, what we're really talking about in some regards is metabolism, but in this case, I think they're saying first pass effect, where when you give a patient a medication and you give it PO orally rather than IV, there's going to be a first pass where some of that gets metabolized, and as it goes to the body, it's not ending up the same way that it started. Sometimes it's good, sometimes it's bad. It just kind of depends. But that's first pass effect. Number 7, the science of dealing with actions of drugs on the body. I think that the answer in here is pharmacology, but this is probably really more pharmacodynamics. So drugs on the body is dynamic. That is, there's a dynamic interaction, and we'll talk about agonists and antagonists in a little bit. But pharmacogenetics is the movement of drugs within the body. And you can think of kinetics and kinesiology, the study of movement, that some people they use that as their major before they become a health professional. Anyway, when you talk about actions of drugs in the body, I think this is more pharmacodynamics than pharmacology. All right, next one, study of how people's genes affect their response to medicines. If you want to split hairs, you can talk about pharmacogenetics and pharmacogenomics. The answer to this one would be, because it's got genes in it, would be genetics. But pharmacogenetics is when you're studying those genetic causes of individual variations in drug response. And pharmacogenomics is that simultaneous impact, when you have multiple mutations in the genome, and how does that affect drug therapy? It's really splitting hairs. People know what you mean, genetics, genomics, but the idea is that we can use precision medicine, make sure that the drug is right for the person. Okay? And you can see the answer there. Okay, unintended pharmacological effect that occurs when a medication is administered correctly. Okay, so this is an adverse effect in contrast to a side effect. So the word unintended is what makes it an adverse effect. We'll use the example of diphenhydramine, which is Benadryl. Sometimes in children, if you give it in children, which you really shouldn't, it can cause a bit of hyperactivity, whereas normally it actually causes drowsiness. So that is the unintended pharmacological effect, an adverse effect. And we'll see that here. The strength of binding between a drug and receptor, this is affinity. So when someone has this real, and we usually kind of talk about this in terms of dating, just because there is affinity, that is, someone likes someone, doesn't mean that it's going to work out or there's going to be any efficacy. You can like someone from afar, especially celebrities. Nothing's ever going to happen. But that's affinity. You like them, and you're going to have some kind of binding. If you have strong affinity for them, then you're talking about a couple, and if there's a weak affinity, then it's from afar. Okay, but that would be affinity. Molecule that prevents the action of other molecules, often by competing for a cellular receptor, the opposite of agonist. So this would be an antagonist. And the way that you could visualize this is you can kind of think of gum in a lock. You can't get the key in there, and it kind of messes everything up. So it blocks the ability of an agonist to perform its action. So a beta blocker is really more formally a beta antagonist. Okay, we can see that one there. Effect of a drug other than the desired effect, sometimes in an organ other than the target organ. So the classic here would be diphenhydramine or Benadryl affecting the brain. We just wanted to relieve allergies probably in the nose and that postnasal drip. And here it is in the brain causing drowsiness. We didn't really want that. But that would be a side effect. Okay. Next one, a drug which binds to its receptor and produces its effect. So now we have the agonist, the opposite of the antagonist. And it's not really the opposite, but this is the one that produces the effect. It's the agonist. And if you think about maybe acting where you have a protagonist and an antagonist, the protagonist is the thing that makes things happen. Not necessarily good or not necessarily bad, but it makes things happen. That is the agonist. And the antagonist tries to prevent those things from happening. You can see it there. And then the last one, the science of drug preparation, pharmacy. Pharmacy is much more encompassing than that, but, good enough. Okay. All right, so that's kind of the drug cards. And the way that I would actually order them, if I were to study this, I would have ordered it as side effect and adverse effect, agonist and antagonist. Then I would have put the 4 of affinity, efficacy, potency, and selectivity together. Then I would have paired first pass effect with dose response, and then kind of quotation fingers effect. And then pharmacodynamics and pharmacogenetics, they're a little bit different. And then maybe, the all-encompassing pharmacology, pharmacy, and that kind of oddball pharmacogenetics. So that's how I would have paired it all up together. And when you have these cards and they're digital, you kind of, it's like, I'll just learn them as I have them. But maybe, copy and paste into an Excel file where you can do that, and then maybe make a column where you're sitting there like, okay, well, what's kind of the first thing that comes to mind? And so when I'm, kind of doing this and I'm looking at pharmacokinetics, I'm like, oh, a kinesiology major. That's what I'm thinking about with kinetics, movement science. Oh, pharmacodynamics, I'm thinking of a dynamic couple coming together, or when things happen like agonism and antagonism. All right, we have a couple of light bulb moments, and these are 6 different cases that we're going to go over. And what we'll do is we'll go over the case, and I'll go over some of the rationales behind it in the next episode, because what I wanted to do was really make sure that this sticks within drive time, and we're getting right around 15 minutes. So look for this in episode 43. Where we're going to go over pharmacology, critical thinking, chapter 1, kinetics and dynamics, and that will be part 3.